Good afternoon. Did you know, according to UNICEF, more than 30,000 children die every day? More than 30,000 under 5 children die every day. And did you know, according to UNICEF, more than 7,000 of these children are from Africa? Did you also know that most of these deaths are preventable or treatable? There's a very big inequality when it comes to child mortality across the globe. In developed countries, the global mortality rate stood at around 37 deaths per 1,000 live births. In developed countries, it can be as low as 1 or even less than 1 death per 1,000 live birth. Sub-Saharan Africa, we have it as high as 77 deaths per 1,000 live births. In Nigeria, our country, we have a very high rate of around 104 deaths per 1,000 live births. This means that in Nigeria alone, around 2,300 under 5 children die every day, mostly from preventable causes. 1 in 6 deaths of an under 5 child in the world comes from malnutrition. Of course, that's one of the reasons because of our large population, but also because of the high intelligence that we have. The global mortality rate has improved in history, but yet sub-Saharan Africa is still extremely very high. So back in 2020, I had an experience that changed my perception of mortality. I met a woman, a very elderly woman, carrying a very sick child, trying to transport this child to seek for medical care. When I met that woman, she couldn't get transport. She's looking for a lift. So I took her. The village is just around 13 kilometers from Bauchi. And while on the road, I was seeing the baby, and I can see life going out of this baby. His eyes are weak. His skin is pale. I can literally see the baby crying, but I cannot feel any sound. I cannot hear any sound of cry. I took the woman to the drugstore that she wants to go, and after some few injections and drugs, she went back. I later learned that 2 days after the incident, the child became critically ill. They had to take him to a primary healthcare center. But it was too late. After some few days, the child has died. It was a horrible experience. When I met the family, the mother was crying. She cannot even talk to any stranger because this is her second child, the second grandchild of the extended family. The grandmother, who has tried desperately to save the life of this child, is also devastated. So also the father. Then I began to ask myself, what could have led to the death of this child? Clearly, the first time I saw the child, there was malnutrition. There is also poor health-seeking behavior. Because the child was sick, they were trying some traditional methods to see how they can revive the child from home. There was also lack of access to health care because they've been trying for some few days to take him to the nearest medical facility, but they couldn't get transport. And then eventually, after, when they could get the child to where he can get medical attention, it was already too late. I always remember this when I'm discussing with doctors, especially pediatricians. And I could remember one of my bosses once always said that, who is actually in the teaching hospital, he said that
our facility is where these children comes to die. That is a very sad narrative. After looking at trying to ponder on issues that could have led to the death of this child, like I mentioned, some of the few. You can see that this is the story of only one child. What of the 2,300 or more than 2,300 that died every day before their 50th birthday? Technology has been the driver of innovation throughout the ages of our existence, from the industrial revolutions to the digital age that we are today. Today, the innovation that is driving the globe today is artificial intelligence. It holds potentials that will drive our world further, solve our most pressing problems, and give us solutions to what we cannot see with our own eyes. But upon all this advancement in technology, a dark reality happens in Africa every day. More than 7,000 lives lost that we could save. That is not just a statistics. It is a moral imperative calling you and I to act and save those children. So I've been privileged to be serving as a senior technical manager and the informatics lead for the Child Health and Mortality Prevention Surveillance in Bauchi, part of a global network that studies child mortality and the loss of pregnancies using very innovative techniques to make sure that we save children's lives by building knowledge and understanding what is the leading leading cause of these mortalities. And our goal is to make sure that we gather all the data necessary, all the stories behind this death, analyze it, and then provide solutions through policies, through interventions to make sure that we reduce child mortality in Africa. In our effort, we have developed 3 streams of data collection. The first is the health and demographic surveillance in the area we are working. We are not working in the whole of the states. We have some areas we are working. So through our health and demographic surveillance, we conduct routine data collection in the communities, trying to understand what is their livelihood, how are they even living, what are they eating, what type of water they are drinking, what is their health-seeking behavior, do they go to antenatal clinics, all these kind of data points that could present a societal risk factors to children or pregnancies. We collect them through the health and demographic surveillance system. The second is the pregnancy surveillance. So in the areas we work, when we identify a pregnant woman, we make sure we enroll her into our pregnancy surveillance to track this pregnancy, to collect all the stories behind the pregnancy. Does she go to antenatal? What type of drugs is she taking? What did she do? What didn't she do that she's supposed to do while being pregnant? These are all collected. All through to the outcome of the pregnancy. Is it a stillbirth? Is it a miscarriage? Or is it a live birth? And in the unfortunate event of a loss of pregnancy, or when we have an under 5 child that died, we activate the mortality surveillance, who go in and make sure that they understood what led to the death of this child. What are the events that really led to the death? And we employ a lot of sophisticated techniques, including what is known as the minimally invasive tissue sampling and verbal autopsies, so that we really understood what led to the death of this child. So after collecting all this data, it's not only about the data collection, but about what we do with the data. We bring all these data points together, the community data, the pregnancy surveillance data, and the mortality surveillance data, and then we look at it. So imagine a data point that has been worked by various professionals, from telepathologists to pediatricians, to microbiologists, to information technology professionals, to social and behavioral scientists, to demographers, everybody working together to see we work towards one goal of reducing child mortality. At the end of the day, what is our goal? To make sure that we understood what needs to be done to reduce this mortality in our communities. Imagine, let us just imagine if we can use technology and the data points we are having, the power of artificial intelligence, to really look at those data and do the wonders of AI. I believe we are all using AIs in our phones and our tablets and our laptops. We have seen the wonders of AI. What if we can use AI to make sure that we save lives in our communities? That is our goal. Saving lives is not just my dream. It's a moral imperative for all of us, for you and I, to come and work together to make sure we reduce child mortality in Africa, so that against all odds, we can give opportunity to each and every African child an opportunity not just to survive, but to thrive. Thank you.